Can everybody see the PowerPoint?
Yes.
All right, everyone, good morning. Welcome to the July Quality Improvement Committee meeting. I apologize in advance. I'm going to stay off camera. I am sick and I am not feeling very good. So, again, this meeting is being recorded. If you have an issue with being recorded, you can leave the meeting. It will be posted on both the MHSA YouTube channel and on our Lake County Behavioral Health public facing website. I also apologize for this if there's sounds in the background. People are cutting down trees behind my house, so we'll get started. So the agenda for today, we'll start with grievances, then test calls, consumer perception surveys, our notices of adverse benefit determinations, audits and corrective action plans, and then an update on our electronic health records, Smart Care. So for grievances, for the last fiscal year, since we're just beginning our new fiscal year, we had 8 total grievances. 3 that have been resolved that were related to medication services, 1 related to DUI payment that's been resolved, 2 related to quality of care, 1 is resolved and 1 is still open that's about to be closed. 1 alleged violation of privacy, which was resolved, and then 1 related to a dispute over drug test results, which is still open. All grievances are resolved within the LCBHS mandated 60-day time frame. However, DHCS allows for a 90-day resolution time frame, although we strive to exceed those expectations and resolve beneficiary grievances in a more expedited manner. So we put ourselves in a 60-day time frame. Are there any questions about this? And for those of you that don't know or need a reminder, any grievances, complaints, concerns that beneficiaries, their families, the public have, they can contact me. I wear a couple different hats. I'm the grievance coordinator for mental health and SUDS, the member services resolutions officer, which is basically the same thing, and the civil rights coordinator. You can call the office and ask for me, or there's my work cell. Grievance forms are in both clinics, North Shore and South Shore, in English and Spanish, as well as on the County of Lake Behavioral Health Services webpage on that lakecountyca.gov, and then go under departments and behavioral health.
Hey, should we have those at the peer support centers as well?
It would be helpful, yes. I can, Jolene, can you shoot some over to the peer support centers so that they have them if they're not already there?
Yeah, I don't think we have them.
Okay.
Okay, you're talking about the grievance forms?
Yeah, both
Yeah.
English and Spanish.
Consider
Or I
it
can
done.
do it after them. Yeah.
Thank
Okay.
you, Jolene.
Thanks, Jolene. All right, so for our test calls for last fiscal year, it's separated into us, LCBHS, and then our after hours program out of Alameda County. So for all 4 quarters, the blue represents specialty mental health information, and then the green is urgent crisis information. And as you can see, we progressed and improved each quarter, finishing off the last 2 quarters with 100% success rate for both SMHS and urgent crisis information. Our after hours program, roughly the same. It's hit or miss a lot of times, usually hit, but they are getting better. They have new staff all the time, so they have to get used to not just our county, but other counties as well. But our team's been doing great. Our numbers are great. To give you an idea of the progress that we've made, when I started in November 2020, we were at a 33% success rate for everything with test calls, and now we're at 100. So we're doing really well. Our annual consumer perception surveys were amazing this year. Huge thanks to our office admin staff, as well as our peer support staff who just knocked it out of the park. This year, we sent 16 emails out with links, as they have a choice of email or paper in person. 16 emails were sent out with links, 9 were completed, which is a 56.25% completion rate versus last year's 10% completion rate. So that's amazing. And then paper surveys, last year we only had 4 between us and RCS. This year we had 131. LCBHS collected 120. Huge props to our peer support centers and our clinics. So can you guys mute, please? Thank you. So we did awesome. Between now and next year's surveys, we're gonna iron out a few more details to make it a little bit more smooth for everybody. It was also a big struggle with the new electronic health record system because data didn't move as seamlessly. So shout out to Jolene for manually doing a lot of that maneuvering for calling clients. So for last fiscal year's notices of adverse benefit determinations, or no ABDs, which is a formal letter that's provided to our beneficiaries when any decision is made that denies their request for services or reduces, suspends, terminates, or modifies the services that they already receive. The main no ABDs that we have, timeliness for providing services. Typically that's someone calls or gets referred and we exceed the 10-day mandatory time frame to get them their first appointment. So we have those. Those are the biggest. We had about 24 of those last year. Stop, reducing, modifying services. We had 19 last year. An example of that would be, especially a reduce or modify, if someone's receiving case management and medication services and they no longer need case management, so they modify it or reduce it down to just med services, that type of thing. Meeting medical necessity, we had 3 of those last year that people that requested services or referred for services did not meet our medical necessity. And then FSP, full service partnership, we had 3 of those last year as well. Are there any questions on notices of adverse benefit determination? So
let me ask,
excuse
I
me.
was talking mute here.
Oh,
So yes, always it's good when you give examples about those. For example, medical necessity. I had a client I assessed yesterday that was a 4-year-old child. And it's a child that has been diagnosed as within the autism spectrum. And it is already a regional center client and Easter Seals client. The mother was asking for services because the child has concerned behaviors like anger behaviors and hitting the head. So my suggestion in this case is that they reach out for regional center and get some BCB.
Carolina, I'm going to stop you because you're giving a lot of kind of details about it. And I'd like to remind you that this is a public meeting and it's not a private clinical meeting. So I just want to.
Yeah, I just wanted to see in this case an AOBD would be sent.
So I would encourage you to consult maybe with Kate offline about specific instances of NOABDs. But if you have more general questions about the process or any of the questions about the data, that would be appropriate for this setting.
Thank you. Appreciate it.
thank you. Is there any more questions about no ABDs before we move on? So for our audits, excuse me, I'm sorry. For our audits and corrective action plans, or CAPS, the SUDS unit just completed the RCS Thule House audit with Butte County, and they're currently in the process of finalizing that report. Our SUDS analyst, Ken, is going to be meeting with the Women's Recovery Services in the next week for follow-up prior to finalizing that report. And they're currently working on completing the Hilltop Men's and intensive outpatient audit. Our mental health unit is currently working on the findings from the triennial audit. All chart review findings were dismissed due to those big CalAIM changes. Policy updates were the most frequently identified discrepancies, followed by documentation. Many policy updates are being updated by our policy consultant, and as well as they've all been assigned to analysts on the QA/QI team. So we are definitely working on those. Most findings are due by July 31st. However, Vanessa plans to request a 30-day extension for us just because there's a lot of things going on. Does anybody have any questions? I know Vanessa's here if she to answer any questions that you guys might have. Okay.
And just for clarity, it might be more than 30 days. I think originally I was planning on going to 930, which would give us 60 more days. But the reason is we did get a bunch of our policies back from the consultant, but they did not have the CalAIM changes incorporated. So we had to send them back for that addition. And then we're also doing a lot of our own modifications. So it's just a lot of work. But this is not, it's to be expected. Last triennial, it took us a while to get them all resolved, because it involves more than just one piece of correction. Can't just like slap something together and call it good. It's really about distributing that information out to staff and then verifying that change is actually incorporated into our business process. So it's a really it's a systemic change.
Thank you so much for that, Vanessa. I appreciate it. Okay. And finally, our electronic health record, our new one, Smart Care. The BSAs have been amazing, and they sent me this update for everybody. They have been nonstop working and meeting with team leads bi-weekly to address issues and concerns and assist staff, working with fiscal and Cal Mesa to move billing forward, since some services have billed successfully, but not nearly as many as we would need or would like. They're also cleaning up some data migration issues, errors that were recognized, including MPI numbers for some programs are incorrect. Some of the barriers they're encountering include more training needed across the board for all staff, clinicians, fiscal, admin, basically everyone. And then some state reporting is still not 100% functional, CalOMS being the big one. But huge shout out to Michelle and Justin and Matt for all their hard work dealing with this huge undertaking. Does anybody have any questions? I believe Justin's here from the BSAs if anybody has any questions.
I don't have any questions, just a comment that I really like that you have incorporated the slided information into this presentation. I don't recall ever seeing updates. Well, I mean, we weren't migrating to an electronic health record previously, but updates like this. And I think it's really helpful to break down silos. So good job.
For sure. I mean, I've included this slide for the last couple QICs since we integrated it, even before it went live, just so everybody's on the same page and knows kind of what issues we're having, because it helps understand what's going on. And it's a big undertaking.
Yes.
All right, that's all I have. Our next QIC meeting will be held on Thursday, October 26th at 10 a.m. I'll be sending out the agenda and Zoom link probably about a week or so ahead of time. If you have any questions, comments, anything you want to see on the next QIC meeting, please feel free to contact me. You can email me, and we'll get that on there. But I appreciate everybody taking the time this morning and joining us, and I will see you in 3 months.
Thanks, Kate.
Thanks. Have a good day.
Thank you.